Hello and welcome to another podcast from BMA News. I'm Polly Newton and this week I'm looking at the drive towards 7-day working in the NHS. There's more and more evidence to suggest healthcare is safer and outcomes better when patients have access to the same level of service at the weekend as they do from Monday to Friday. But what impact does that have on doctors? Will they face widespread demands to work around the clock? No, says Nick Bishop, Senior Medical Advisor to the Care Quality Commission. Dr Bishop, a consultant clinical radiologist, chaired a recent conference in London which looked at the delivery of a 7-day service in health and social care. He explains what's meant in many cases by 7-day working.
Certainly, if you look at the Royal College of Physicians' publications on this, what we're talking about is at the very least more senior presence in the hospital at weekends, so that there are weekend ward rounds in exactly the same way as there are weekday ward rounds.
Dr Bishop says there are potentially significant benefits for clinicians, including less stressful Monday mornings.
The science is there that demonstrates why you've got chaos on a Monday, because you have the most number of admissions over the weekend with the least number of discharges. And so it's not surprising that your Monday morning elective patients haven't got a bed. So by smoothing out these disparities over the 7 days, we can do something about improving things on Mondays.
Also speaking at the conference was NHS Improvement Director Fiona Thau, who's put together a dossier of 7-day working case studies from across the health service. She says in most cases this kind of change has been led by determined clinicians who want to improve services for patients.
They really understand the clinical drivers and the importance to patients and can persuade their colleagues to come on board with clinical arguments and safety arguments. And also I think it's demonstrated for us, particularly for junior medical staff, having senior clinician support 7 days a week is really important.
But surely increasing the presence of senior clinical staff outside so-called routine hours is an expensive path for the NHS to follow. Back to Dr Bishop.
Cost, it has a small part to play, but it's not as big as most people think. We're talking about a redistribution of the workforce here, and inevitably that's going to involve a rethinking of people's contractual commitments and so on. But we're not actually talking about increasing the amount of work we do. We're talking about delivering it at different times in the week.
Ultimately, says Dr Bishop, it should be done because it's best for patients.
Mortality rates are higher for those admitted at weekends. We need to move towards a situation which is fairer for patients, and I think most people who go into healthcare professions want to see the best outcomes for their patients, and that is going to be delivered by 7-day working.
For more information about providers which have moved towards 7-day working, take a look at the case studies at www.improvement.nhs.uk/7-day services.